Dr. Yelverton from Rochester Regional Health. Dr. Yelverton is a dermatology oncologist and a Mohs surgeon, and Dr. Lertzman is a dermatologist at Rochester Regional Health. Thank you for being here today.
Thanks for having us.
Happy to be here. I know we've spent time together before talking about skin cancer, and today we're going to nuance that just a little bit and talk about a procedure in particular. So as always, I want to remind the audience, please feel free to ask your questions in the comments section, and we'll pause and take a break and make sure we try to get them answered. So let's start with a real basic discussion about what are the different types of skin cancer. So let's just kind of educate the audience on what is skin cancer, what are the different types.
Okay, so most commonly there are non-melanoma skin cancers and melanoma skin cancers. And of course there are various other types of skin cancer that are less commonly known, like Merkel cell cancer. There are lymphomas of the skin.
Okay. Okay. Are there, the most common though is the one we hear about?
Is non-melanoma skin cancer, which encompasses two different kinds of skin cancer, the more common being basal cell carcinoma, and then the less common being squamous cell carcinoma.
Just quickly describe those two, because I know myself, I hear that and I think, okay, what's the difference? So just high level.
Okay, so basal cell carcinoma is more common, and it usually will present in sun-exposed areas of the skin as a pimple or a sore, a shiny papule, which is a bump, that doesn't heal, continues to bleed or itch. And squamous cell carcinoma, which is still common but a little less common, also presents in sun-exposed areas, face, scalp, ears, back of the hands, sometimes the lower legs. And that will present more as a scaly spot that also continues to ulcerate, not heal, itch, or sometimes even be painful.
So in case I forget to say this later, I want to say it now. So if you're somebody listening and you hear that, what's the first thing someone should do if they, because I know myself, you look at a spot and you think, oh my God, is that skin cancer? What's the recommended path for somebody?
Okay, so I wouldn't get nervous. I would say, I always tell my patients, if you find something that's concerning, that looks different than your usual things, that's not healing, continuing to bleed or itch, I would say mark on your calendar about 4 to 6 weeks ahead of time and write down check left cheek or wherever you find that spot.
Interesting, okay.
And if it's still there and bleeding or itching, then you need to call your dermatologist and get in for an evaluation.
That's really good advice. That's actually really helpful because it makes it very common sense. I was shocked to learn about the number of cases of skin cancer diagnosed every year. It's higher than prostate, it's higher than breast. I mean, that's shocking.
Yeah, so there are over 3 million cases a year in the United States of skin cancer diagnosed. It is the most common cancer, and there's a lifetime risk in the United States of about 1 in 5 people will develop a skin cancer.
Is it that, well, we could probably do a whole, I think we talked about this too, why are we seeing the increases in it? But it's just, it's so interesting to me, and I think sun exposure is such a huge part of it. Ozone layer depletion is, obviously contributing to that. So something we need to pay attention to. What are the risks? Is there a genetic component or hereditary risk for skin cancer?
Absolutely. So in addition to being fair skin, light eyes, and having significant amounts of UV exposure, albeit from the outside, from the sun or from indoor tanning salons, having fair skin is inherited, and if you have a parent, a brother, or a sister that's had skin cancer, you're at increased risk for getting a skin cancer. And additionally, if you've had a previous skin cancer yourself, you're at increased risk for getting another skin cancer.
Okay. I want to ask this question too, because someone in my office just said this last week, and it made everyone stop. All the women in the office who get their nails done, those solar nail lamps are just like sitting in a tanning booth, right?
Yes, that's UV exposure, which
that shocked me
for getting skin cancer.
I mean, I don't think anybody, we didn't put it together until we were talking about it. Now everyone stopped getting their nails done that way, anyways. Let's talk about the early detection of it. So I haven't done an interview where we've talked about cancer where early detection hasn't been early detection, early cure. So I don't assume this is any different. But let's talk about why that is so important and then the things that people should pay attention to and do.
Right, so early detection is very important. So checking your skin once a month, a self-skin examination, looking for anything unusual, different, out of the ordinary, itching or bleeding is important. Coming once a year to a board-certified dermatologist for a good overall skin exam is also really important. And the reason for early detection is that when skin cancer is caught early, both melanoma and non-melanoma skin cancer, it is easily treatable usually in the office, with a simple surgical procedure, and will lead to much less disfigurement and potentially even not lead to death, which it could potentially lead to.
So I want to talk about that too, since we're on that topic. So just walk the listeners through. So if you go to your dermatologist and they find a spot, the typical approach would be to excise it at that point in time. Is it something that's done in office, or you schedule another time? Let's help educate folks on that, or both.
I would say both. I
Yeah.
think it depends on the nature of the appointment. If you're coming in for a full body skin exam, you may get rescheduled to have the spot off. It depends also that, like I said, there are different types of skin cancer, so it depends on the clinical assessment whether it's an emergent type skin cancer, and a lot of skin cancers can wait a week or 2 or 3 or even a couple months to be excised.
Okay.
So,
And is there the same risk of sort of lymph node involvement with skin cancer as there is with other types of cancer?
So yes, especially with melanoma. So
Okay.
there's non-melanoma and melanoma type skin cancer. And with melanoma, we do worry about lymph node involvement.
Okay.
Hence the reason for getting something early, because then presumably it hasn't had time to travel to the lymph nodes. So that would be an important part of an exam for skin cancers, to check the lymph node basins also.
Okay. So I know we're going to talk about Mohs surgery because I think it's incredibly exciting, and I want to get to that in just a second, but I want to stop and ask, are there any questions that have come in?
Are all skin cancers treated the same?
No, all skin cancers are treated the best way for that particular type of cancer and for that particular patient and for the location of the skin cancer. So a lot of them are treated with surgery, which is great because that can give a very good high rate of cure. But it really depends on the type of skin cancer, the location, the patient, the preference, and those kind of. That's why it's important to see your dermatologist, and they'll be able to make a good plan for you.
It might seem silly, but like sunscreen in Rochester in the winter, I mean, how often should people
Still
be doing it?
necessary.
Still necessary because there's still UV exposure, and so you want to protect your skin from UV all year round.
I remember when we did our last session together
Right.
too, one of the things we talked about is, I remember doing it in one of the sunscreen every day, right? It doesn't matter if
Every
you're
day.
tanning or not, it's protecting your skin every day.
Yeah, absolutely. You should put your sunscreen on every morning, and if you're outdoors for the day, your sunscreen should be reapplied every 2 to 3 hours, especially if you're perspiring, if you're in a wet environment. Yes.
Okay. So I want to transition to talk a little bit about how you two collaborate together in the work that you do as a dermatologic oncologist. So let's start there. How do you two partner together in the care of different types of skin cancer? And then we'll talk about Mohs.
Sure. Well, like Dr. Lertzman said, there are a lot of different ways to treat skin cancer. There are topical therapies, there are oral therapies, pills that you can take for certain types of cancer. There are lots of surgical methods. Some of those are destructive, where we kind of scrape tumors off, and for superficial tumors those can be very effective. And then there are kind of more excisional techniques where we're actually cutting things out.
Okay. So it's a referral. So let's help folks listening understand kind of if they came to see you and there was a certain type of skin cancer that they found, you might refer them to Dr. Yelverton for a procedure, correct?
Exactly. So
Okay.
like Dr. Yelverton said, some are treated with pills or creams, some are treated with simple surgical procedures, some are treated with destructive surgical procedures, and then there are times when Mohs surgery is needed, and that's when we would make a referral to the Mohs surgeon, Dr. Yelverton, and we're in direct coordination, and we can set that up for the patient.
So let's talk about what Mohs is. So let's describe to everybody, Dad.
Yeah, absolutely. So Mohs surgery is just a specialized type of skin cancer removal. It's typically done in the office, all under local anesthesia. And the way that it works is that the cancer is removed with just a very small margin of normal skin around it. The idea is to conserve as much normal tissue as we can, but still get the cancer cells out. And what's really different about Mohs surgery is, in addition to taking it out with a small margin, we have a pathology lab on site where we check the edges of the tissue under a microscope to make sure all the cancer cells have been removed. If after the first stage there are any cancer cells at the margins, we take little bits of skin, so just kind of small shaves of skin to take a little extra tissue and make sure all the cancer cells have been removed. And again, the idea is keep the hole very small. That way things can be reconstructive in the best cosmetic sense as well.
And when did you start doing Mohs surgery?
I've been doing it for about 10 years.
Okay, so it was new then when you learned to do it 10 years ago?
Not new, so the technique has been modified over the years, but originally Dr. Mohs, who the procedure is named for, first wrote about it in the 1930s, so it's actually been around
Wow.
for almost 100 years. And it's been modified over the years, and certainly availability and training in the procedure has changed over the years. But I would say from the 70s and 80s up through now, it's just been increasing in popularity. And part of that is due to the increase in the amount of skin cancer that we're seeing. There's just so much more skin cancer. There are need for these specialized procedures. And given that most skin cancer occurs on the face and head and neck areas, those are areas where we really want to conserve as much skin as we can, give patients the best outcomes.
So it's not, I want to, so doing it this way obviously preserves less scarring, but it seems to me like it's a little bit different in that the pathology, you sort of, the margins, you can do all that, reduce incisions and...
Yeah, exactly. The way the pathology is processed is a little different than a standard removal, and so it allows us to look at the entire margin of what's taken out, and that allows us to be much more precise in terms of doing it. And so we get a much more accurate picture of how far the cancer is spread.
So talk a little bit about the training that you had to go through, and I'm sure it's probably something that you consistently revisit, I would assume.
Yeah, absolutely. So the training is a regular dermatology residency, which includes exposure to Mohs surgery and a fair amount of that, and then an additional fellowship, which is typically 1 to 2 years after residency, where you do training specifically in the surgical removal of cancer, in the pathologic interpretation, and in cosmetic reconstruction of these areas.
And how many do we do approximately on an annual basis?
We're doing about 500 a year in our office, but growing rapidly.
And it, you might have said this, but I want to make the connection too. It's for a certain type of cancer. Is it also the severity of that cancer, or the depth of it, so that this reduces the impact to the tissue?
Yeah, absolutely. So,
Okay.
I mean, again, the deeper the cancer, I mean, then, again, doing it this way allows us to kind of get in there and see how deep it goes and track it out.
Yeah. I had a colleague I worked with previously who had it done on their nose, and I was amazed, given the depth of the cancer, that it really reduced the visible scarring. What I guess I want to make sure people listening understand too is your doctor, the dermatologist that you're working with as a patient, would be the person to help guide your thinking around whether or not Mohs surgery is the right for the type of cancer that you have, correct?
Yes.
Okay. Okay. What about Mohs surgery didn't I ask that is important to make sure people listening understand?
I think the unique things are, one thing to prepare people for if they're going to have Mohs surgery is that it tends to be a long procedure in terms of it takes several hours.
Okay.
And again, that's because we have the patients come in, we take it out, we check some pathology on the tissue. So most people are there for 6 or 7 hours to get these things done.
Doesn't mean things are worse. It just
doesn't mean
means
things are worse. It's just something to prepare for. It's
Yeah.
hard to prepare people in advance that they're going to be there all day for a doctor's visit. But at the same time, the idea is if we do it right the first time, we don't have to do it again and again because
Yeah.
we got it all out.
Yeah. That's great, and I think it's fantastic. We're unique in offering this procedure in this area, correct?
Yeah, there are very few places that you can get it here in Rochester.
That's great. I'm glad that we have that service available.
Is there a typical place where you see a Mohs procedure done on the body? I mean, I know you mentioned Mohs.
Mhm.
Yeah, it's appropriate for most cancers of the head and neck, but our most common areas are the nose and foreheads and ears, places where you want to save as much normal skin as possible.
Just send a general message to people that are going to the tanning bed. It helps.
Don't.
We had this discussion before too. So I think one of the things that's important to reiterate is we're here talking about how you treat skin cancer. The ideal state would be that we keep people from getting it in the first place. So let's do some quick reminders about what are the best ways for people to prevent skin cancer. And I know you mentioned sunscreen is one, but there's some basic things that I think people just need to continue to be reminded of.
Certainly, sun protective clothing, shade structures, avoiding the strongest UV exposure between the hours of 10 and 2.
Okay.
Those are the main things.
And I always ask this question because I think it's hard to know. You see sunscreens out on the market now that have SPFs of 100 or greater, and I think, and I've heard things that say anything above 50 isn't really doing much. So what's kind of the truth around what's the right SPF of sunscreen that you should be using on your face and your body?
Yeah, I think there is some marginal benefit to higher SPFs, but the reality is anything above a 30 is probably, there's marginal improvement above that. The real issue is most people don't put on sunscreen thick enough when they put it on, and they don't put it on often enough. So the reality is you should put it on before you go outside, rub it in. It should take some effort. They say about a shot glass worth is enough to cover your whole body, which means a typical bottle of sunscreen should only be 2 or 3 applications. It really shouldn't last you a whole year or multiple years.
We're all going to go clean out our sunscreen closets now.
But put it on nice and thick, and again, like Beth said, reapply every couple of hours if you're going to be outdoors. That's how to get the best protection.
Okay, it's a really good reminder.
Beth,
Phil, question?
Freda Lertzman and Brooke Lertzman are watching. Do you want to give them a shout out?
Shout out to the family. Hi.
That's
Thank you.
cute. That's cute. Happy Mother's Day.
Thank you. Thank you.
Okay, so I always ask this question when I'm interviewing care providers. Why did you choose what you chose? And tell us about your path to becoming the physician that you are today.
Well, my grandfather passed away from skin cancer. So
I'm sorry.
Yeah, so it hasn't mean to me. But I love what I do. I get to meet all kinds of interesting people, and I get to help them, and
Yeah.
that's what's great.
Yeah, I'm sorry.
That's okay.
But he'd be very proud of you.
He would.
Yeah, I mean, for me, it's very similar. I really love the interaction that I have with patients. I really love being able to provide a service where I know there's a 99% cure for their skin cancer, and so there's very low likelihood that it's going to come back. I do like the fact that they're in the office all day because I get to talk to them and know about their families and their kids. We feel rushed so much in medicine these days trying to get patients in and out. It's nice to be able to spend some time talking to our patients.
Yeah, that's neat. Thank you. And 99%, say that again.
Yeah, so the cure, most surgery offers a cure rate of about 99% for most basal cell and squamous cell carcinomas.
That's pretty powerful.
Yeah.
I also want to make sure that we share what's happening. We do have an event tomorrow. Would one of you like to talk about the event that we have? I can give the details.
Sure. So tomorrow, Saturday, May 11th,
Yep.
from 9 to noon, we're doing a skin cancer screening. It's free to the public. It's going to be at the Lipson Cancer Center at Rochester General Hospital. Anybody can come.
And I'd strongly encourage people listening, if you've never had, it can be intimidating because it's like anything. If you think, if you're worried that someone's going to find it, the process of getting yourself there becomes overwhelming. But it's worth doing in the baseline knowledge that you have nothing. And I do think what you said before is really helpful. We get used to looking at the things on our body, and then once we become familiar with them, if they don't change, then typically it's nothing.
Absolutely.
And that's real common sense advice, but it's hard sometimes to remember that.
Yes, skin cancer, you can, fortunately, for a lot of them, see them grow and change right before your eyes.
Yeah.
So come in, don't be nervous. The treatment is usually very simple and curative, and yeah.
That's great. Mm-hmm. Anything that I didn't ask that you think, either one of you think would be helpful for our listeners to know? Since we have your faces on screen.
An ounce of prevention goes a long way.
Yeah. That's really great advice.
Yeah, absolutely. I mean, we used to tell people that most of their sun exposure happened in childhood, and that's, the evidence just isn't supportive of that. It's really cumulative over your lifetime, so you can do things to change your risk factors even moving forward. So even if you've had a lot of sun exposure, wearing sunscreen now helps.
Yeah, that's also a really good reminder. Let me check with Phil. Any last questions?
It's Nurses Week. Do you want to give any shout outs to any nurses you guys
Oh,
know?
yeah. Hi to the nurses at Genesee Valley Dermatology. They do a great job, and Clifton Springs Dermatology.
And shout out to all the nurses at Linden Oaks Dermatology. They're awesome.
And a shout out to all the nurses at Rochester Regional Health for everything that you do every day to take care of the people that we are privileged to serve. I want to thank you both for being here. I appreciate you taking the time. It's nice to spend some more time with you. I think it's great to educate folks on this. And again, the Mohs procedure. If someone wants to learn more about it, contact your office.
Yes, they can contact our office. There's also great patient resources out there. The American College of Mohs Surgery has a very good patient website, and
That's
it's
great.
just mohscollege.org.
That's great. So thank you for listening. Thank you for being here.
Thank you
Again,
for
happy
having us.
Mother's Day.
Thank you.
And I look forward to spending more time with you again in the future. Thank you for listening. Have a great day.